maybe it would be a good idea for us to introduce ourselves to each other's streams and go over what we're going to be talking about today.
Yeah, totally.
Awesome.
Would you like to go first?
Sure, for lack of better times. For everybody who may not know, my name is Suris. I cover politics over on YouTube and Twitch. Sometimes I'm here in the flesh, sometimes I have a VTuber avatar, sometimes I'm distracting myself talking about Magic the Gathering, so much so that I made a secondary channel where all I do is talk about Magic the Gathering to try to get it out of my system. It didn't work, by the way. Making a second entirely monetized channel to talk about Magic didn't get it out of my system. I think I have a problem. It's called an addiction. I've sought help. Unfortunately, the help was a booster box, so I don't think it was the right kind of help.
I hope you get help with your cardboard crack addiction. Absolutely.
I hope I do too, but I don't think it's gonna work. Anyway, what about you, Naomi?
Howdy, I'm Nominal Naomi. You can just call me Naomi. I mostly talk about queer rights, trans issues, sometimes politics broadly, maybe Magic the Gathering if y'all are lucky every now and then. And I'm a PhD candidate. You can go check me out over on YouTube. It's where I post most things these days. I also have a pretty big TikTok channel. That's where I kind of found my way into the sphere. And yeah, excited to be here. We're covering this new Detransitioner documentary today.
Yeah, I saw this thing pop up a little while ago, and there's a few things in it that I can speak to, like obviously data points, correlation, causation. A lot of this stuff is pretty easy to speak to if you've been involved in these spaces long enough. But there are some parts that I can't speak to. Like, there's some, a spoiler alert for the documentary, there are some points where she's going to talk about the way the trans community was kind of pressuring her into doing one thing or another. I'll say her just for this. I guess that's what she identifies as now, because
it seems that nowadays she identifies as a woman.
Yeah,
uses she her pronouns.
Even
so I'll use she her.
Even that gets kind of complicated with this particular documentary, but where she is, a lot of her stuff is with the trans community and how it treated her, which for me, I can speak to a small degree because I'm a content creator who does a lot of work when it comes to trans people. Obviously, I've got a bias here. My girlfriend is trans as well, and I want to do everything to make sure that the world that we're in for her is safe. But
transgender lover, absolutely.
But I don't spend as much time inside those communities, so a lot of that stuff just isn't stuff I'm going to be able to speak to. It's not experiences I'm going to be able to speak to. The most I'll be able to speak to is like my audience calling me an egg over and over again because of my VTuber avatar. Which is not the same thing as having like a lot of experience dealing with that community. So I wanted to go ahead and bring my friend Naomi on because she might be able to speak more towards that side of things, and obviously is very, very good, better than me, in fact, when it comes to researching these kind of topics. As evidenced by DMs I'm not going to link where I was at the gym. Meanwhile, I was getting a bunch of snippets from the documentary and a whole bunch of stuff about the court case that I had not looked at all yet. I was busy trying to figure out why I'm normally able to lift 120 on some of the machines, and today it's 90, and I don't know where my strength went. I think depression, but that's neither here nor there.
But yeah, no, a lot of this stuff is just entirely public, and you can find stuff online. This particular detransitioner, she's like suing her former doctors and her practitioner who provided her gender affirming care, top surgery, etc., etc. And like you can just find her court case publicly available online, and it's incredibly easy to find discrepancies and just like so very clearly that there's not a real case there. So from like a perspective like, is this going to cost us trans rights? No, but it's good to get like an insight into like how exactly these kind of right-wing orgs are weaponizing or utilizing these kinds of bogus court cases just to generate outrage and debunk that.
And I think we came to do another spoiler for this particular video. There was a disagreement that we had in DMs about strategy, and we ended up coming to like a middle ground on that disagreement. For my case, I felt like this would be, because of the way the Supreme Court has been stacked, the goal here would be to have a case that is very, very public, that will obviously fail, and then move the case, appeal the case up until you can get past the districts into the Supreme Court, and then the Supreme Court will likely rule in the favor of the detransitioner, because of course it is stacked so heavily in the favor of conservatives right now, and I figured that would probably be the strategy angle, but you had a different take on that.
Yeah, I think that these court cases, like the major foundation that are behind them, know that they're bogus, know that they're not going to go anywhere. know that based off of all legal precedent and laws in place that there is just no chance. And really the main goal of these kinds of court cases is just to generate outrage. But, you know, in kind of talking with Suris and coming to more of like a middle ground, I suppose like it's very possible they're like primarily focusing on generating outrage with their bogus case, and then just whatever wins they might happen to passively take, trying to appeal their way up, like they're going to fight for those and take what they can get.
Yeah, it's and a lot of this comes down to the fact that several of the organizations that get involved in this kind of stuff, like obviously for this one specifically, it's not Heritage, but Heritage is the big one in the news right now because of Project 2025, obviously.
Mm-hmm.
A lot of these corpos have been doing this stuff for 60 years. Heritage specifically was Nixon era, gave the playbook for the Reagan era, and they're trying to give the playbook again for the potentially current Trump era. So a lot of these orgs are used to playing the long game, and they're very, very flexible with how things work. As an example, with Project 2025, the minute that Project 2025 became very, very known to the public media, they publicly said, oh, we recognize that Trump is going to pivot away from us publicly because that's the strategic thing to do, but we're going to still keep doing our thing. And then the head of Project 2025, or one of the heads of Project 2025, you know, gets taken off the project, gets taken out of Heritage, and so they go, oh, we're going to stop our policy work on Project 2025, but we're still going to work on getting all the policy makers in. So it's like no matter what angle they lose a battle in, they've got some kind of win they can still cling to. So I'm used to that kind of thing from conservative orgs, where they will go in and recognize, yeah, we will probably lose these cases, but if we happen to win, if we just so happen to play our cards right enough to win, then we're going to ride that into the sunset as far as we can. And that's just based entirely on how I'm used to seeing these organizations work, which...
Yeah. My point is it's super shady, and they know what they're doing, and they know that they don't really have a genuine case here. Yeah. But it's good to examine. It's good to examine.
Rand says, is that the training videos? No, the training videos is a completely different thing that we covered yesterday. That's a whole different can of worms, where like 19 out of 30 people on the Trump administration were in the Project 2025 training videos. That was that was bizarre. Did you see that, by the way, the that information that came out?
I did not. I remember pretty recently the information coming out about JD Vance was like super connected to like the authors of the Project 2025. I think it was like he had a direct connection to the guy who wrote the foreword to Project 2025.
Yes, he had a direct connection to the person who wrote the foreword. The newest thing, though, is there was a hack that Iran is currently claiming, not them publicly, but an org within Iran is currently claiming that they successfully hacked the Trump campaign and leaked a whole bunch of information to news media. A lot of that information, a lot of news outlets like Associated Press are saying that they are not going to release that information because of journalistic integrity reasons. Rebecca Jones, who got in a lot of hot water down in Florida, said that she would be willing to leak all of that stuff if it came by her desk, because she's not held to the exact same standards as, say, like the AP is. But the big takeaway with all of that, ProPublica, what they did showcase was all of the training videos that are used, so that they've basically got if you've ever worked like a corporate retail job, you've had the moment where you sit down to training videos where they're like, here's our organizations and why unions suck. That's a very common thing in that area. So the training videos here are that, but for Project 2025. So it's a bunch of people from Trump's administration, a bunch of people that he has said that he wants to put in positions of power, are the ones doing the training videos that ProPublica leaked. So now it's even harder for them to be like, yeah, no, it's a totally separate thing. It's totally different. It doesn't, that strategy doesn't really work anymore.
That's starting to make a lot of sense. I had heard about like these leaks that they did happen, but I had no clue like what was leaked, because I think I only saw it when like first came out.
Yeah, and I still don't know everything that was leaked either. Because, like, they're not showing us everything that was leaked. They just said, hey, here's the stuff we're able to show you, and that stuff's pretty damning.
That's just like the tip of the iceberg, right?
Yeah. And, like, I don't want to put the you know, tinfoil hat, do the conspiracy theory thing. I don't. That's not very useful. But we have enough information to go, this is all fucked. But that's that. That said, we have a wonderful, in quotations, video to watch. What we'll do is, as we're watching it, if there's ever a point in time where we feel the need to speak up, just say stop. We'll stop the video, and we'll go ahead and give our point there. Or if it's something we've got insight on from research that has been done previously, then just we bring it up there. Just normal React Andy video response stuff.
Let's do it. Awesome.
Alrighty. Let me know if the noise levels are too high for you.
I didn't like how my bottom growth looked, but I assumed that...
Is that fine?
Yeah, it seems about right. I think you're a little bit louder than the video. Let me go ahead and adjust you a little bit down, and then my overall volume a little bit up. I think that should probably be good.
Alrighty. And let us begin this travesty.
I didn't like how my bottom growth looked, but I assumed that I would like it better as it went on, because it would get bigger and then it would look like a real penis. I didn't like the way that my chest looked after surgery, but that was just because it's not healed yet. Once I don't have to do all this recovery stuff anymore and it just looks normal, I'll be happy.
Okay, pause there.
Yeah.
I know we kind of teased this out a little bit before, but I think one of the interesting takeaways from this case is that even though they're really trying to frame this as like some kind of clear cut, like she's just a detransitioned woman, has always felt like a woman, just wants to be a woman again, like a lot of her statements there pretty clearly indicate that there's still some kind of gender dysphoria going on. Like, it's not that like she had bottom growth that was upsetting, it was that it didn't look like a cis male penis.
Yeah, she had phalloplasty. And the phalloplasty, I'm going to assume
she did not have a phalloplasty. She just had bottom growth from hormones. So if you're like FPM,
so wait, she didn't
and you
even
go on testosterone, then your clit basically like grows into a little micro dick.
Yeah, it ends up being like what, 2 to 3 inches or so.
Yeah.
So wait, hold on. So she didn't even go. So she's upset that she got some growth, but it wasn't everything that she wanted it to be. So hormones are magic. HRT does a lot of work. But there are some limitations to it, and there's a time frame as well where HRT is going to be doing a maximal amount of work and then less work later. A lot of doctors will say, like, hey, by the way, this is the prime area as you're going through effectively second puberty. This is your prime area for breast development if you are, super concerned about that. A lot of trans people still end up needing to supplement that with surgery afterwards because you don't necessarily know how your body is going to react to the hormones when it starts redistributing fat, when it starts doing all the things that a puberty normally does. You don't know everything that's going to happen. This is also one of the reasons why most doctors will not allow you to have breast surgery or certain other cosmetic surgeries until after you've been on HRT for an amount of time, because they don't know what kind of body they're going to be working with while you're doing that.
Just like any kind of like cisgender person's puberty, like puberty takes time, and also puberty is really dependent on your genetics. Like what kind of changes you're going to get in puberty are going to heavily depend on your genetic makeup, which you don't really know until it happens. And there was one other thing I wanted to say. It was about like effects that happen like earlier versus later. It's actually pretty surprising, like just how much changes happen with a trans person transitioning even like super late into life. But kind of the biggest change that people go for like super early would be to not undergo effects of like your natal sex puberty. So like, for example, if a trans man can transition before puberty, then like he'll never grow boobs, and that's awesome for him, because then like there wouldn't be a need for top surgery down the road, and that's fantastic. The other really big change that people try to target for super early is bone growth. So like bone structure, bone plates don't fully fuse until about the age of 25, but like the earlier you start, the more you'll have bone structure that more closely matches like a cisgender person of your gender identity, which is super cool for the people that are able to go on puberty blockers and transition early.
There's also some other parts about that as well that tend to be pretty helpful. Like, for instance, there are some people who don't realize that your voice doesn't actually tend to change all that much when you go from male to female, when you start taking those hormones. A lot of times you need vocal training. However, if you can get on puberty blockers early, if you can get on HRT around 17, 18 years after you've been on the 5 years we usually allow for puberty blockers, that can actually allow you to not need as much vocal training because the shape of your larynx doesn't develop the way that it does during a male puberty.
Well, yeah, that's why, like, I mean, little boys and girls, like, don't sound all that different at all. And, like, it's really puberty that causes vocal folds to lengthen if you are undergoing, like, a testosterone-dominant puberty. So trans women that don't undergo that puberty, their voices are just as feminine as a cis woman. And love that for them. Love that for them.
All right, let us continue.
Also love the leading music and
It's
the
very
tone.
It's trying very hard to make us feel sad.
I was a very girly kid in a lot of ways. I was homeschooled all through elementary school and middle school. I loved being outside. I was just a really happy kid. I realized I liked girls when I was 12. I was worried that being gay was wrong, like I didn't really know very much about it. So I went on the internet and I found a lot of content.
I like how it's just rainbows.
Well, yeah, when you like Google gay, like that's what I get. It's like I like girls, and then I just get pictures of rainbows. Nice.
But no, this I feel like, and I haven't watched the full documentary yet, but I'm gonna go out on a limb to say this sounds like what she's gonna lead us into is I wasn't trans, I was gay. Like that's because I've seen that narrative pop up a lot. You're not really trans, you're just gay and confused. But we'll see.
Explaining what gay means, what a lesbian is, what bisexual means, and with that, what transgender means. I was still pretty satisfied with my life at 12, so there was no reason to really latch onto it, but I started having mental health issues. It got worse when I started going to public school in 10th grade. I didn't identify as trans yet at this point, but the majority of the people in my friend group were trans, and I felt a little bit left out sometimes because I was the cis friend in the group.
Okay, I gotta pause there.
I started going by Violet.
Absolutely.
That's crazy. That's straight up crazy. I cannot imagine like somebody being ostracized from a friend group because like you're cisgender and the friend group is transgender. Like you can be the token cis person. Like that's okay.
It's I can't speak to it one way or the other there because my experience was being the person in the friend group that ostracized the trans person. Like that was me in high school. I was that person. Like to the point where that person found my channel, got pissed that it was monetized because of how I treated them in high school.
Oh damn.
And then contacted me and was like, and then I actually watched some of your stuff and realized that you've changed as a person from then. You're not the person who did all that shit then. And now like they're a person who I go and visit whenever I go back down to Florida. But like my experience is the opposite of the going, oh, you're a person who I'm not supposed to like because I'm Christian. You're a person who's abnormal. I don't want to deal with you. Go away. This is too socially awkward. That was my experience.
And especially these kind of like smaller towns, like there's a pretty generally well understood just like queer camaraderie amongst queer people. Cause like, I mean, I can think back to like my high school experience, like the queer kids found each other, be they gay, trans, and me going to high school in like the rural Midwest, like there was only probably like 2 or 3 trans kids in my entire high school, and like, but they found their camaraderie amongst other queer friend groups, and like that's just much more realistic for how that actually works in practice, or the narrative of like queer people being kicked out by straight people.
Yeah, it definitely feels weird to be like, no, the gays were kicking me out for not being one of them. Like that doesn't tend to happen as often. Usually they'll take whatever allies they can, as long as you're not being a bigot. Like whatever, I don't know what this person may have been doing there, but if they were being bigoted, then yeah, that might be a reason to not have them in the friend group.
Yeah, I don't know. I think it seems to me as like this person's probably kind of just like gone back and re-narrativized their high school experience, when in reality what probably happened is they experienced a lot of like gender envy or gender euphoria with like seeing their friend group, which would be a lot more consistent with these seemingly still present feelings of gender dysphoria that they seem to have.
That would make sense. Like you found these people because they were more accepting, and you were able to learn like, oh, these feelings that I'm having, they are valid. This is what they mean. These are the things I can do to address them. It makes more sense that way than, well, I guess how we're gonna have it framed.
Yeah.
Instead of
I mean, that's
Christina,
what you get when you re-narrativize.
Yep.
because I liked it better, I guess. I actually had one of my trans friends tell me that they thought it was weird that I was changing my name without identifying as trans. It was during that
How though?
time.
I think that what she's probably saying is that her friend called her an egg.
Yeah.
I think what she's probably saying is like, it's kind of weird that you're like, I'm cisgender, but I want to change my name. I don't really resonate with my birth name, and I want this more androgynous name, and et cetera, et cetera.
Yeah,
Like,
that would,
are you?
that would
Do you
track.
think you might be an egg? That seems a little weird. I'm guessing that that's kind of what was said, but we can't know for sure.
That the COVID-19 pandemic hit. Lockdowns started right in the middle part of my junior year, and the online school was just the nail in the coffin. I got cut off from like in-person contact with all of my friends, and I just had nothing to do except sit and ruminate on my thoughts and my anxiety and just...
See, that part is a little crazy to me because I recognize that COVID was a very isolating experience for a lot of people, but in the year 2020, we had a billion ways to socialize with people that we didn't necessarily have like physical access to. Like there were more options for your mental health even then, but I don't know. That's just a kid who grew up on
one of the big
MMOs
challenges was like, especially during that time, like you had to be making an active effort to be maintaining mental health, maintaining social connection. Like I absolutely agree that there were resources out there, but a lot of people just weren't utilizing those resources and did definitely isolate themselves. But there's also some truth to this phenomenon of like quarant transitioning. Like I was a quarant trans. Like I transitioned during COVID. It was a great time to transition because, you know, people were offline, not seeing each other for so long. You could have like months and months and months to transition and just come out of the quarantine a different gender. It worked great for me. So
yeah, fair enough. Again, this is just like my experience as somebody who like plays a lot of MMOs, plays a lot of games. My social experience primarily has been online outside of like being at card shops.
kind of rot in my house. And I started watching a lot more trans content on YouTube and TikTok. I was depressed and self-harming. I didn't want to be alive, like at a lot of times. It struck kind of a chord with me. I had been having anxiety around the size of my chest for a while at this point. I actually did buy a binder before I even identified as trans. There are a lot of guides, you know, how to find your size, how often to wear it, so that it's safe.
I'm guessing that was more evidence.
Eventually I got a job.
Friends kind of egg posting about her. Like,
yeah.
I'm guessing her trans friends would have known. She's like, oh, hey, I'm trying out a binder. I'm trying out a new name.
And it's like, yeah, we kind of get that. we figure that's what you're doing. Though there is a little bit of information here to take for people in my audience who may not know. Binders are actually dangerous to wear for extended periods of time if you are not careful. Like,
yes, that is true. That is true.
Do be careful with them.
Oh, the other thing I was going to say is I think it's really telling how, like, active her language is in showing that, like, she was the agent that was initiating all of these decisions.
Yeah,
like,
it wasn't the friend group.
She wanted to change her name. She wanted to wear a binder. Like, this narrative of, like, she was swept in by a transgender cult that was, like, pressuring her to do things, like, that just doesn't check out with all of the active language she's using.
Yeah.
At a grocery store, and I would wear it to work. I only did a couple times, but it hurt really, really bad.
You were wearing a binder to work. 8 hours at a time for a binder is not healthy. That, of course, that was going to hurt.
Yeah, this is why we need, like, LGBTQ inclusive sex education, broader just like body education in general. Like, I mean, there are going to be trans mass people that want to bind, people that want to reduce the appearance of their chest, and like, I just want them to be able to do that safely, and like having that kind of education in school is like really important for actually accomplishing that.
Yeah. You know what else solves this problem? Like for most people, just in general, puberty blockers. But it's, you know, they're bad and evil and wrong.
Well, true, but it seems like she would be a case where she wouldn't be like identified with puberty blockers.
Yeah, she didn't necessarily know, because like the time frame for puberty blockers is a few weeks after puberty starts. That's typically when we start.
At least the optimal time frame. You can definitely start them like later, but it would just kind of like pause you where you're at, basically.
Yeah.
But I didn't want to go without it because I was kind of psychologically dependent on it, and I was seeing myself appearing to have the body I wanted made it really painful to take it off. Because it hurt, I stopped wearing it, and I started wearing kind of a sports bra that I was hoping would, you know, still make me look a little smaller, and the pain did not stop. I eventually had to...
This is one of the reasons why a lot of trans people tend to wear, like, before HRT, tend to wear, like, very, very baggy clothes. That's, like, a big stereotype that we'll see because they are looser, more androgynous. It's harder to tell what's going on under there, and it helps with dysphoria to a degree.
Yeah, the dysphoria hoodie stereotype. Absolutely. Very common experience.
Yep.
I quit my grocery store job because of the shoulder injury that was caused by binding. Now, I still can't lift heavy things. It sucks. I initially started...
I will say real quick, she didn't say specifically that she worked at Aldi, but that is the imagery that they're using there, is that Aldi was the store. Fun fact, Aldi has one of the better healthcare plans in the United States. As somebody who used to work for Aldi, you get it between 3 and 6.
Fantastic.
Yeah, you get it between 3 and 6 months of your time at the company, and not only is the pay rate pretty good there, you get a lot of time to sit down, but the only part about your healthcare that tends to cost a lot is if you get a family plan. Those take a chunk out of your paycheck. The usual ones are actually pretty affordable. So shoulder injury, bad, but there actually were potentially some options for this person if they had known that options were available. Because, again, Aldi. That's just going with the imagery that's shown there, though. They're just showing Aldi
and like if you do
specifically.
end up injuring yourself from like binder usage, like you should see a doctor about that. They can usually help.
Yep.
I started talking about the fact that I was questioning my gender around August of 2020, and I flip-flopped back and forth a lot before coming out as non-binary agender in November of that year. Initially, I didn't want testosterone. I only wanted surgery. I thought that would help me reach my androgynous, genderless body goals. But old peer group that I hadn't had contact with for a while had been on testosterone for a few months during the pandemic. And I was really jealous of how deep their voice had gotten. Maybe I do want testosterone. Like, maybe I do want to go down that route. I started actively pursuing getting testosterone in November 2021. I had heard online about Planned Parenthood as a provider which will just give you hormones if you want them and doesn't do any kind of gatekeeping.
Funny about that is, I do not have experience with this, but from what I understand, that's not entirely true.
So are you talking about Planned Parenthood in particular, or like hormone therapy broadly?
Hormone therapy broadly is that there's generally a lot more conversation that has to happen before you're able to get it. There are some ways to circumvent some of that conversation, like Plume is obviously a resource where it's entirely geared for trans people who know like what's going on, they know what they need, they just need the prescription so they can move forward.
Yeah, so in the US, there's kind of generally like two paths you can take. The first path is going through like doctors, psychiatrists, primary care, endocrinologists, like, and that will involve a lot more like heavy screening, psychological counseling. It'll be a bit of a lengthier process, but if you're like really unsure about your gender identity, unsure if hormone therapy is right for you, or if you have like a lot of like underlying conditions that might kind of impact with hormones or might be risk factors for hormone therapy, then this is a really good option to just like really get that thorough evaluation.
Mhm.
And then the other option is informed consent hormone therapy. So informed consent is a type of medical practice where basically you are informed of all of the effects that taking a medicine will grant onto you. You're informed of all of the benefits, all the risks, informed of like potential outcomes, what you can expect. And then you, as an adult, will give your signature, your consent, and they'll just give you the medicine. And Planned Parenthood operates under the informed consent model. I actually started HRT just by going through Planned Parenthood.
Okay.
And so with the informed consent model, usually it'll just take like 1 or 2 appointments. You'll sign some paperwork. You'll go over all the effects. And they'll even give you like a handout you can take home with you that will basically explain, this is the medicine you're consenting to take. This is all the effects it'll do. Kind of like onset, risk factors, and how they're going to manage it, like upkeeping with labs every 3 to 6 months. And so,
Okay.
the Planned Parenthood model is informed consent. Now, if this person had a lot more concerns and worries about, like, I don't know if this hormone is right for me, then you can go down the traditional medicalized, talking to psychiatrists and primary care and endocrinologist route, which he chose not to do.
Okay. And I guess it makes sense though if she chose not to do that, she had informed consent, and this is an adult who
You have to be at least 18 for informed consent.
So this is an adult who did not get manipulated into a certain thing. Even her friends were literally just going, "This is weird." Like that's it. That was the language that was used. It's weird that you're taking a name and you are not necessarily trans. That's as far as it goes. So there's no peer pressure here. There's none of that. It's just, I was envious of this, so I went down the fastest route I possibly could go.
And I looked at the actual court documents, and really interestingly, in the court documents, they actually have like her Planned Parenthood, like meeting notes where they included details like saying that she had been identifying as a trans man for over a year, that she had been living socially, at work, at home as a trans man for over a year. Like the story that they had in her clinical notes is very different than the story they're telling here, which either means that she just lied to her doctors in order to get hormones, which absolutely does not help her case that she was doing this informed consent thing the correct way, like just lying to your doctors to get hormones. That's not how you're supposed to do informed consent. Or like they're just really stretching the story and not showing a period of at least a year where she was presenting and living as a trans man.
I would assume that it is the second one. I would assume that this person was benefit of the doubt. I would assume that the person was giving the correct information to the doctors, doing their best there, and then the documentary is going, what gives us the best narrative for the story we're trying to tell? Cutting out this information, cutting out this time, that gives us the best narrative. That seems to make the least assumptions in my book.
I think that it's probably a little bit of both. I think there's definitely a tendency for non-binary or gender fluid trans people to more so like try to binarize themselves when they approach like doctors and trying to seek hormones. And so I think that the story that she told her doctors definitely like really put herself into the gender binary in a way that, from everything that I've seen her present, isn't necessarily how she presented herself.
Okay.
And so I think there's probably a little bit of combination of both. Either way really points to, like, she could have at any time chosen to undergo a more traditional psychiatric endocrinology route, and
instead chose
she
the
didn't
fast
choose to do that.
route.
She chose to do the informed consent route.
Yeah. Fair.
So I showed up at Planned Parenthood 3 weeks after I had turned 18. The appointment was definitely less than 30 minutes if we take out the waiting room time. I sat there for a few minutes waiting for the doctor to come in, and she actually wasn't a doctor, she was a nurse practitioner. I didn't know that at the time.
I don't think that changes anything for this particular story, does it? Not really.
So nurse practitioners, basically, they are nurses that additionally have a full-fledged PhD and are able to prescribe medicine. That's basically like it's not quite as much as a full like traditional MD, but it's like in between the amount of school you would need to be a nurse and the amount of school you would need to be a full-on medical doctor.
Yeah, this just
And they're
seems
able
like
to prescribe medicine.
this just seems like a way to construct the narrative. Like if I'm putting myself in the shoes of a propagandist, right?
Mm-hmm.
It seems like a way to push the narrative that a non-expert pushed hormones on me, and that's what happened. That's...
Oh, yeah. I mean, I see why they would do that. I know that, like, in the actual data, most HRT is prescribed through nurse practitioners because for most patients that access this kind of medicine through informed consent, they're not going to have any kind of, like, background medical conditions that they're going to need to manage more intensively. Most people that are trans these days go through the informed consent nurse practitioner route because that's just what the medical need for these most trans people are. But for the people that really need that more intensive care, that more intensive evaluation, that more intensive, hormone blood work, like that's what these other doctors are for.
Mm-hmm.
She sat down with me and went over the informed consent. It was 3 pages long. There was alternatives listed. The alternatives were surgical masculinization and, quote, you could do nothing. So the options were testosterone, surgery, or nothing. And I didn't want to stay like that, like depressed and like not wanting to be alive.
Hold up, that's a bit of a twisting framing.
Okay.
It's not that it's hormone surgery or nothing for your depression, your anxiety. That's for whether or not you want to transition.
Yeah,
there's surgery, there's hormones, or there's no medical intervention. Like those are the options for transitioning. If you're talking about managing depression, other mental health, then yeah, there's other options that exist. But she's absolutely twisting the framing of like what it means when it says you could do nothing instead of going on testosterone.
Yeah, so for those who may not recognize, maybe there's younger people in my audience who don't understand this at a base level. Hormone therapy, transitioning, all of this, it is not depression medication. It is not. If you have depression as a comorbidity of gender dysphoria, then obviously it will help there, but you need to talk with a professional to figure out if that is the case. But if you have depression, if you actually have issues with serotonin and dopamine levels, you might feel a little better after transitioning, but the actual underlying depression might not be there. If your dopamine receptors ain't working, titty skittles are not going to make the dopamine receptors suddenly start working. Like, that's not how your brain works.
Yeah, it's really complicated because gender dysphoria often has depression as like a comorbidity. It's kind of like treatment-resistant depression. And what we find in actually the data about like trans people with this kind of treatment-resistant depression, it seems that hormone replacement therapy is actually more effective than antidepressants because their problem wasn't actually like major depressive disorder. Their problem was gender dysphoria.
Yeah, their problem wasn't the dopamine receptor not working. Their problem was I looked in the mirror and I didn't see me.
Right. And so sometimes like clinically, gender dysphoria might get confused as depression if the trans person like isn't aware that they're experiencing gender dysphoria. But for people that are experiencing depression outside of just gender dysphoria, then yes, both of these conditions ought to be managed.
Actually, I can speak with a little bit of experience on this because when I was talking with my doctor ages ago, back when I had health insurance, about getting on depression medication, I ended up getting on Klonopin for depression and anxiety. But when I was having those conversations with my doctor, one of the first things they asked is there any like stimuli in your life? I'm not using their exact words, obviously, but is there any stimuli in your life right now that you think could be the cause of this instead of us going the route of trying to medicate this? Is there something in your life you think you can change that will help this that you should be focusing on first, which typically is where like a psychiatrist or a therapist can help you out a little bit more. But when the doctor's sitting there, the most they can do is just be like, did you take these steps? No? Okay. Like, that's the best they're going to be able to do there.
So I was prescribed testosterone the day of the appointment. She talked about some of the risks with me in a very kind of nonchalant way. A known risk of testosterone use is liver damage, potentially like liver tumors. I know that now. There was no discussion of that. There was a
It's just like there's a risk of getting breast cancer when you go on estrogen, because as you grow breast tissue, you are literally giving the food that breast cancer cells need to survive on. This is
This is a fun fact, but I know data exists that shows that trans people are actually not at any more risk of cancer than cis people, but by medically transitioning, you essentially just change which types of cancers you're at risk for. So, like, for example, for trans women have like a pretty much a next to nothing % chance of developing prostate cancer, which is one of the most common cancers in cis men. Meanwhile, trans women gain more of a risk of like breast cancer, for example. So overall cancer mortality, not any higher in trans people. It just kind of like trades some risks for other risks.
Yeah, so like it's interesting that there's a focus on here going like, oh, there was a problem that I could have developed in my liver. I'm like, well, of course there was, because you start taking the hormones that change the physiology of your body to more like to be closer to a different gender. You're going to start taking on the risks of that gender. That feels like that's one of the most no duh things you could have considered. But
it's honestly amazing how little people know overall about like what exactly hormones do. But I mean, for people that really delve into the biology, like hormones from womb to puberty to adulthood are the primary cause of actual any kind of sexual differentiation of characteristics. Like it's hormone influences in the womb that cause you to develop like what kind of genitals, reproductive system, and then hormones during puberty is what causes men and women to start looking different.
Yep. It is also the fact that these levels are not always super consistent, which is why we can get intersex people. Sometimes people develop XXY chromosomes. Sometimes their gametal structure looks a little different. Sometimes they have a what's called ophotestes, where their gonadal representation goes, yeah, you have the testicles, but they're inside the body. And there's a whole slew of ways the body can not mess up in this regard, but create what we now know as a bimodal distribution for sex, as opposed to a binary distribution of sex, because of the way the hormones work in the body. It's a fascinating topic for those who care about it.
A conversation about fertility. She went into a little spiel about how you can still get pregnant if you're taking testosterone. Immediately after that, she pivoted into testosterone may completely take away your ability to get pregnant. I said to her that...
Yeah, because it's not a binary. It's not that you take testosterone and then suddenly you can't get pregnant. It's that you are taking testosterone so it can interrupt some of the natural things that happen in your body that allow pregnancy to occur, ovulation. But if you are taking testosterone, the way your body reacts to that testosterone may not necessarily suddenly make you infertile. There's plenty of trans men who get pregnant.
Yeah, the other thing that I want to mention on that front is that oftentimes the reason why they give this advice is because if you're going to come up with the best, most comprehensive plan for what you're going to do, you want to account for the worst case scenario in both directions. So like if you're a trans man, for example, it's like you need to account for the fact that you might still be able to get pregnant. So using protection, taking PrEP, for example, like these kind of things are still important if you have a partner who could produce sperm. On the other hand, you need to account for the fact that it's very possible that this testosterone will make you stop your period super quickly, that you're not going to be able to get pregnant. And so, like, if you want to have biological kids in the future, then it's good to look into fertility preservation methods, like, harvesting some eggs, freezing some sperm, something like that. So basically just account for the worst possible scenario in both directions. And that's why the doctors give this advice.
Sidebar, speaking of things that can help with depression from the previous conversation, I combined all of my stuff and got both of my Sensei's Divining Tops finished.
Ooh,
just
fun.
while we've been here.
It didn't matter because I didn't want to have biological kids. She didn't press the issue and still prescribed me testosterone.
Cool. Sounds like she did her job.
I did know that clitoral growth was a possibility. FTM communities online usually talk about it, they call it bottom growth. The way that people talk about it is that it's like your body is growing like a small penis, and that it like won't look like a clitoris anymore, it'll look like a penis. So it's...
I mean, that's because the clitoris and the penis, anatomically speaking, are the exact same organ. They're the same thing. It is just dependent on what hormones are being fed to it. That's it.
Yeah, and it's really fascinating. The clitoris is one of those organs that it can still be affected by testosterone, even like much later in life, where it will elongate and start to develop kind of like, basically the hood will develop more like a foreskin, and it kind of looks like a little penis. But it really depends on genetics and like the individual person. But yeah, bottom growth it's wild.
Actually a good thing. And I bought into that, I guess. I didn't fully get what it would look like. I didn't understand how the sensation would change. I was not as informed as I would like to have been, I guess.
But you went into the informed consent model. So instead of going through about a year of like psychiatric therapy for this or anything like that, you literally took the fast track route. The onus was on you as an adult to do the research here. The doctors can give you a bunch of information about risk factors, but they cannot give you in like a small session a holistic idea of what you are going to experience. Again, that's what the informed consent model is.
You just can't know for sure. Like if she wants to know like what exactly is her bottom growth going to look like, you can't really know that until it happens. Yeah. Like this is, I mean, for a trans woman being like, okay, well, like what boob size am I going to grow? Like you won't know that until it happens. Like
for my girlfriend, when she had that conversation with her doctors, they said, we can't know, but the best thing we can tell you is look at your family's history, and that is something you can expect. But even with cis women, there are women who end up being outliers, for instance, when it comes to breast size. You have a mom who has, very smaller chest size, and then a couple kids come out and they have smaller chest sizes when they become adults, and then one kid just comes out and there's G-cups there. And there are lots of factors when it comes to physiology. We do not know all of them until all of the building blocks have been put in place. Again, this is why doctors will not do several of these surgeries until you have had HRT, because they'll go, that's not the body that we're going to be working with. We could give you breast implants if you really wanted, but like, if you're going to go on HRT, if we give you these, recognize you're going to grow breast tissue behind what we do, and things are not going to look normal when we're done afterwards, like once everything is finished.
But no, it's fascinating how like so much of this works. Like everybody has all these like genetic encodings that are turned on and off by hormones. So I mean, every cis man out there has a genetically encoded breast size that they'll just never find out unless they start taking estrogen.
Or you start playing an MMORPG and playing a night elf.
There you go. Same thing.
My parents didn't love the idea of me transitioning. I think they kind of felt like they didn't have that much say in what I did.
Well, of course, you were an adult. Their say stopped when you became the legal age of 18. That's how that works.
Because, as soon as I was 18, I could just walk into Planned Parenthood and get hormones. I don't know what her argument here. Is she trying to say like she wants her parents to have a say in her own medical decisions after 18? Like, if that's what you want, you can talk to your parents and be like, hey, do you think this medical decision is right for me? Like, you can include them in the decision-making process if you want to, but
yeah, like you
have
don't
that
want
ability.
To,
I don't know why she's making this argument.
No, I don't know what she's necessarily trying to get at here at all.
Which I was saving all of the money from to save up for surgery. And everywhere they looked online was telling them, if you don't affirm your kid, then you don't love them.
That's true. I don't know what you want. That's true.
Testosterone felt like you would imagine an antidepressant would feel in an ideal world. It was a massive placebo effect. I was experiencing these like changes that were making me look more like a man. My voice was getting deeper.
My name is Oren, and this is my voice one day on T.
My name is Oren, and this is my voice 4 months on T.
Like, I was getting hairier, which I didn't love, but it made me look more like a guy, and that was my goal. The clitoral growth, again, I did not like, but I thought, like, you know, like, I don't like it now, but, you know, it's gonna get bigger, it's gonna start to look more like a real penis, like, maybe I'll like it then.
Pause here.
Yeah.
I think this is something that's talked about more and more in trans communities these days that I've seen, is like people who are more non-binary or gender fluid, and like people that seem to want kind of like a mix and match of sex characteristics.
Mhm.
And everything that I've seen on the medical side of things, on the advocacy side of things, has been very clear about like hormones are going to do what hormones are going to do. You can't really mix and match. And so if you're in that kind of space where you want these kind of mix and match characteristics, like that would be a case where I would be much more like working with a psychiatrist, working really closely with doctors, because you can't really pick and choose. There is an option to like go on hormones for a little bit and then go off the hormones, where you'll incur some of the permanent effects of those hormones, but ultimately you can't pick and choose the effects you're going to get. And so if you want to do hormone therapy, you have to be on board with every single change that's going to happen.
Yeah, like that. Again, the way the body works, it's a bimodal distribution. There are two extremes you have. The hormones are going to pull you towards that other extreme. You may end up somewhere in the middle. You may be able to stop things at some point. Like, for instance, breast tissue growth is permanent. That's a thing that does not reverse when you stop taking a hormone. So, like, if you go, hey, I want facial hair, but I want breast tissue, if that's your goal, then, you know, if you're born male, you have the facial hair, that's probably going to happen regardless, and then you go on hormones for a year to maybe even 2 years. You may end up having to get two hormones for that, because sometimes it's like you go on estradiol for general transitioning purposes, and then you have progesterone that's also helping specifically with breast growth. Your doctor's going to be able to help more with that when it comes time. But if you go, hey, these are the secondary sexual characteristics that I want, there is a degree to which you can get them. Stoff says, hey, that's me, but I'm AFAT. Yeah, I know. You're my example, Stoff. So Stoff is one of the artists who has done work on my channel, or the one who did the slime bell animation for my channel. But no, Stoff, you are my example for this particular type of transition, because I have seen within people who are close to me this particular kind of transition, but it is very precocious. Not precocious in the way puberty is precocious, but it's a balancing act, and some people can get it and some people can't, and you just have to be on board either way.
Yeah, I advise people to be a lot more careful if they find themselves in that kind of camp, because hormones are going to do what hormones are going to do.
Yep.
It never got to that point. I don't think it does for anyone. Shortly before I started testosterone, I started seeing a newer therapist who was directly kind of affirming and encouraging me to go on testosterone and to get surgery. And I ended up like finally having the money.
Okay, I need to
Once
pause
I had
here,
been on-
because in the court documents, this is framed completely differently.
Okay.
In the court documents, it's framed as she went to her therapist saying that she wants to go on testosterone, she wants to get top surgery, and the therapist is like, awesome, yeah, cool for you. Like, the therapist affirmed it because she said she wanted that.
As opposed to the therapist persuaded her that this is the route that you need to go, which is completely different.
Yeah.
Great. How dare the therapist be accepting? Yes, Red Joker, 100%. How dare they?
On testosterone for almost a year.
My name is Oren, and this is my voice 1 year on T.
Option and the closest.
Congratulations, you've just given one of the best arguments for universal healthcare possible. We don't have to afford the cheapest options under universal healthcare. Anyway, that's just my tangent.
Also, crazy thing, I looked at this surgeon, and across like multiple review boards, Reddit testimonies, even like the Google page for his reviews, like he's consistently rated as this outstanding surgeon. Like,
Yeah.
just a stand-up, like the kind of framing is like saying, oh, she went with this shady, cheap option, when like you can look up this guy's public record and all the testimonies of people that have had surgery with him, and he seemed to have an outstanding record.
Like, you can see I remember a while ago there was this drama about one surgeon who did mastectomies and did not do them correctly, did not properly follow up with patients, and there were like chest infections and stuff that happened as a result amongst her patients. But that's obviously an outlier compared to what's typically seen in the medical industry because, and malpractice gets taken out.
Yeah, and the other thing I was going to say is there's like a really extensive like trans community network of like sharing experiences with surgeons, like people writing up their testimonies, their reviews. There's a whole subreddit, I think it's like trans_surgeries, where you could literally search for a surgeon by name and find all of these testimonies and results pics from people that have had that exact surgeon.
Yeah, so you can figure out
that's
if this
how like
is
the trans
what you want.
community like self-polices these few and far between bad surgeons. But this guy was clearly not one of those. He had fantastic ratings across the board.
Assist option, so I wouldn't have to stay overnight anywhere. He is mostly a plastic surgeon who does other kinds of procedures like boob jobs and like facelifts. He has a whole section on his website for FTM surgeries.
So he's very qualified to do his job and has extensive experience. I'm failing to see the problem.
He also didn't require a letter of support from a therapist. He said that was mostly for insurance purposes, and he only did out-of-pocket surgeries.
Okay.
I went in for a consultation.
I found more about that in the actual
December.
court case. So
Okay.
the way that this guy bills surgeries is he bills them as like cosmetic surgeries, and that way you wouldn't require any kind of like therapist letter in order to acquire. So she basically got this surgery under a like cosmetic surgery label.
So once again, we are in the same boat of she went the fastest route possible. She deliberately chose the fastest route possible and received the results of the fastest route possible under an informed consent model, which is what you would expect for anyone in this situation ever, period, no stops. Cool.
How dare they give me exactly what I asked for?
How dare.
That's very normal. Most
Okay.
of the times, you'll have your consultation with the surgeon, they'll schedule out your appointment, and then that's the surgery. Like, did she want to do a second consultation? You could request a second consultation, but if you're not going to request a second consultation, then that is standard practice to consultation, you see your surgeon, operation, you see your surgeon. I mean, that's what happened with my orchiectomy, which I just had a month ago, where I saw my doctor for the consultation, and then we were there for the surgery.
What are you talking about? You didn't have the balls to do that surgery.
Not anymore.
February.
I'm still upset that you made the joke about it that I was going to make when I sent it to you in your DMs. And then I looked on Twitter, and the Twitter AI just put your profile up saying the same joke. I'm like, now I'm angry.
Beat you to it.
Draw the size that I wanted the grafts to be on a tissue box that was just on the table next to me.
Is this an attempt to frame it as unprofessional? Because, like, that's... How else are you going to show the size? Like, do they want you to get, like, a ruler and just go this many inches long? Like, what would have been the better option there?
Yeah, I'm not sure. I mean, if you wanted more consultation to be able to work that out, you could have requested an additional consultation. Also, if you were like on the day of surgery and getting cold feet about it, like you can still cancel. Like that is still possible.
Yeah, like you can consent to cancellation.
He gave me a marker and he offered to show me his nipples for a size reference, which I declined.
Okay, society doesn't see male nipples as a private part. We haven't seen male nipples as a private part for a long time, which is a different discussion entirely, but like I don't see that as particularly inappropriate. Maybe I just grew up in Florida where you go to the beach and you see everybody's nipples who's male and it's just kind of a normal occurrence. I don't know what I'm supposed to take from that.
Yeah, I mean, like, it seems like he probably perceived that, like, she was unsure or maybe felt kind of, like, awkward or, like, not really having a reference. And so, I don't know. At most, it seems a little bit awkward.
Yeah.
But
They could.
You deliberately chose a route that allowed you to not have to do overnight stay. You said that already. You specifically didn't want to do overnight stay. So of course they're going to free up the bed.
A very well-documented, well-known, well-explained side effect of anesthesia that nausea is very common. They'll usually give you nausea meds before you go down for anesthesia, as well as nausea meds when you wake up after anesthesia. I had rounds of nausea meds both before and after I went down for anesthesia for my surgery, so that's pretty common practice. I didn't have too much nausea, luckily, but it kind of depends on the person. And like, once again, like while you still have that IV in you out of surgery, you can absolutely request more nausea meds.
About correlation and causation for just a brief bit. So, yes, there are people who end up detransitioning and do experience trans regret from HRT surgery, etc. However, and in terms of how often this happens statistically, it is effectively statistically insignificant. When it comes to all surgeries, there is a certain level of regret after surgery. There is
the average for surgeries is about 8%, by the way. And when you compare that to trans surgeries, the average is about 1%.
Yeah, trans surgeries
have a significantly lower regret rate than most surgeries.
The common go-to example is knee surgery, where there's a very, very like significantly high
20% regret rate for knee replacement surgery.
Yeah, regret rate for that. But it is still considered a common and helpful surgery for enough people that a 20% regret rate is considered acceptable. And obviously, we're still doing things that we can to make sure that that knee surgery can be improved. From experience, there are friends of mine who have been in car accidents, who have had these kinds of like reconstructive surgeries, and would have rathered them just lop off the leg entirely so they could use a prosthetic instead, because the pain associated with it would be infinitely less than the titanium rod and bone regrowth. But the point is, these are still helpful surgeries that are done that have a much, much higher rate of regret than most trans surgeries. So while I feel bad that this singular individual had an experience that was not apt for them, when I think about this in the context of every trans person who has ever undergone any of these surgeries ever, almost everyone who I know, you, my girlfriend, various people in the chat who are friends of mine, Jack and Quill, everybody who I know who has undergone any of these procedures, whether it be HRT, surgery, etc., pretty much all unanimously have a positive experience with those things, with the, whether it be surgeries, whether it be HRT, etc. So unfortunately, though, what organizations like the org that is currently funding this documentary, funding her court case because she's trying to sue for, is it technically a malpractice suit? Like, what's the actual grounds?
I think that malpractice is one of the grounds she's suing on. They're like going down like this whole laundry list of grounds. But the other thing that I wanted to say was, like, it is just a consequence of the fact that we perform medicine, that we perform surgery in general, that regret happens. Like,
yeah,
it would be
it
impossible for us to perform medicine with a 0% regret rate for any kind of procedure. And medical regret sucks. And I truly wish people the ability to get any kind of corrective procedures, corrective measures they can for medical regret. And especially as we continue to research trans healthcare, as we get better at, transitioning from one gender, one sex to the other, like, that will help out detransitioners too. Because if we invent technology to grow breasts in trans women, as we get better at doing that, we'll be able to better help people who may have surgical regret. And this is going to continue to get better over time. And I hope that she can access the care that she needs nowadays. But yeah, it's just an unfortunate reality that surgical regret does happen. And that if people are unsure going into a surgery, you don't have to rush into it. You can take your time to figure it out, to talk to psychiatrists.
Yeah, you don't have to, at the ripe old age of 18, the minute you become adult, rocket your way through all of this. You've already experienced the puberty. That part's already done. The time-sensitive portion is when you're going into your first puberty. You're past the time-sensitive portion. You can wait if you desperately need to. If you are concerned that I might end up regretting this later, you have that ability. But again, you went under an informed consent model. The assumption is you're an adult. You did this.
From the legal perspective, like, her court case was over from the moment she signed all the informed consent documents she did. Her signature on the informed consent documents is enough to absolutely sink her court case.
Yep. Morbid Palace points out surgical regret is a thing. It's not exclusively trans ones. True. So what organizations like the one that is funding this in our court case will try to do is they will create a big media spin about this. This is to Naomi's original point on what the point of all this is. They'll create a big media spin about this where people are talking about, oh, what about people who detransition? What about people who have regret? And no matter how many times we can counter with the truth, which is, yeah, they are statistically there, but they are not statistically significant enough to worry past just acknowledging that they exist, that doesn't matter because the general public is not so informed and unfortunately not so invested so as to care that much that that's the case. All they care about is that people did regret it. So what about others? It creates this gap.
Me, as far as another thing about numbers and significance, there was actually a number quoted in the article about her, which said that in total, throughout all of the legal court cases with a detransitioner suing their providers, there have been a total of 18 throughout all of history.
18.
18 of these kind of court cases ever. The people that are trying to say there's millions and hundreds of thousands of detransitioners, we've all seen it's the exact same handful of detransitioners that are flown across the country everywhere to run these court cases, and
yep,
even reusing these people, 18 is the total number.
Yeah, there's a video I made a long time ago that was about how to construct a narrative for normies, and that wasn't the actual name of the video, but the point of the video was the way that our brains work, the way our pattern recognition works is we will willingly, consensually, subconsciously consensually, we will fill in blanks on anything. It's a survival mechanism for us. It's how our brains operate. So if we provide a handful of detransitioners to tell their story, then providing more than that handful, finding more than that handful even existing, is not necessary for getting your brain to go, these are only the ones I see. What about all the ones I don't see? Your brain's already done that work for you because, again, we are pattern recognizing creatures. Whether it's logical or not, it is how our brains evolve to operate. People who are salespeople, because that's what most of the people who are doing this are trying to do. They're selling a narrative. They recognize that's how the human brain works. This is why conspiracy theorists will often frame something like this, just as an example. And if that's all the stuff we know, what about all the stuff we don't? And then suddenly your brain starts going into overdrive, trying to think of all the stuff that we potentially couldn't know about, say, Jews in the bank industry, or pedophiles in Hollywood, or what
gay
have
frogs
you.
drinking the water.
Yeah, or you know, the frogs making the water. The frogs were gay already, but they drank the water, and then they became super gay. Like, that kind of stuff.
Exactly.
Like, Rand says that she was even in sales. No, she was in retail, which is not sales. I've been in sales and retail, and they're two different industries, one far more predatory than the other, in different reasons. Jessa says the frogs make the water gay. Yeah, the frog juice went in the water became gay water. That's what it was. If you've ever
the frogs turning us gay all along.
Yep.
I should have seen it.
Staff says the human brain works. I was under the assumption the majority of human brains were dysfunctional. No, actually, neurotypicality is still just that, typical in the human brain. Like, there are far more people in the United States that are neurotypical than, say, autistic.
But are the neurotypicals okay? Are they?
No, they are not. I want to say we are not because I haven't had any official diagnoses, but my chat keeps on telling me I definitely have ADHD and probably autism.
Yes.
God damn it! Look, just because I beat you in a literal autism competition.
I'm a pretty heavy hitter in those autism competitions, I gotta say, though, so.
Jesus Christ. Jessa says you are some form of spicy.
I tried on one of my old, like, feminine cut tank tops, and I just looked in the mirror and saw just how flat my chest was and how my rib cage stuck out. Now,
have you considered protein?
Bulk up.
If you're worried about that, then like that diet is the thing that you do to solve that problem. I don't
hit the gym, bulk up.
Like, I don't like how my body is shaped, and I don't like how it's shaped even more now because as I've the first like 15 pounds I've lost since my diet and going to the gym shaved off the middle part of my body, so now I've literally got an hourglass figure, which feels really weird.
Nice.
And I'm not a big fan. I kind of miss when I was more blobless up in Yonkers, but I can't control where the fat loss happens. Like, again, if you do not like ribs showing out, peanut butter sandwiches, and that's it. Just some fatty protein.
I could also say there are plenty of trans men out there that are like bricked up gym cells that are fully rocking like the pectorals after top surgery. Like these trans men, they can absolutely bulk up and hulk out if that's their goal. You just gotta be a gym bro like the rest of them.
Yeah, just go to the gym. Like my exercise routine is quite literally days I don't go to the gym, I play Pokemon Go with my girlfriend, going outside
really
and walking.
lawyered up instead of hitting the gym.
just hit the gym. That solves your problem. Hey, it also tends to do a lot of good for depression. It doesn't solve it, but you know, this funny thing happens with lactic acid. Lactic acid in the body is actually an addictive substance. Like
That's true. They say that like no matter how bad your workout was, how hard it was, like nobody regrets you going to the gym. Like you do that workout, you go on that walk, like you never regret it, even if it was hard and difficult and you had to get up and go out and actually do something.
Yeah, Dragon Quill says mine's always wrists and lower arms. I can't, for the life of me, lose the stomach fat. You didn't seem like you had that much when you were over here when we went to Anime Weekend Atlanta, and I beat you in a sword fight. That didn't seem to be the case, Jack.
Now, it was really horrible, and I stopped at that point, and again tried to kind of suppress it. I went out, and I just broke down when I got home. I just felt so much regret, and I told my mom, and I told my girlfriend. I felt horrible about everything, about my body, about my life, and the fact that everyone has been kind of playing along with this for years.
Wait, you're now sad that everyone in your life was supportive of you. That's the narrative we're going with. You are sad everyone supported you. The world would be a better place if everyone around you had just been a little more bigoted. That's where we're at?
I mean, that's what our court case is asking for.
I'm gonna stab myself with a rainbow Vaporeon now. That's my goal.
Don't do it. Don't do it.
Too late.
Dang.
Years now, and I was wrong the whole time. The next day, my mom gave me one of her long sleeve dresses, and I wore that all day. I shaved my legs, which were so much hairier than they used to be because of the testosterone. I cried a lot that day, and the day after, and the day after.
You know the crazy thing about like all of the negative effects being like a detransitioner like her is that she's just going through what a trans woman goes through.
Yeah, she's just experiencing what a trans person goes through in general when the dysphoria hits.
Yeah, like
That's it.
if you're a detransitioner, like the pain that you experience as a detransitioner, that's the gender dysphoria that trans people feel. Like,
yeah, you're there. Congrats.
Yet they frame it as like far worse than, you know, the 99% of trans people that have been experiencing this dysphoria and are helped in their dysphoria by these kinds of procedures, by this kind of medicine.
Now that she's worried about the effects that testosterone has had, and she wants to look
I
more
can sympathize
feminine.
with that.
Yeah, like I think here's what's happened now. Now she's opened up a world of entertainment for herself. Now Yuko EX videos are far more relatable for her. If you've seen any of those before.
I've not, no.
She's my audience through the wonderful media share stuff introduced me to her. She is a trans VTuber who does a lot of like, let's talk about trans memes. Let's talk about relatable stuff. There was this whole thing where like she accidentally walked out with a little bit of shaving cream on her face and then like ran back into the house yelling, "The world must never know." Like it's just like that's kind of funny. Like it's actually kind of funny, and everybody in my chat is now going like, "Yuko's cool." Yeah, no, her content's entertaining. My audience, it was Espen specifically who used media share to make me watch the video of it was a story that she wrote of a person who was AMAB, got bullied a lot in high school, and then after they transitioned, then she ended up going on a Tinder date with the bully who bullied her in high school, and the bully had no idea that it was her, that she was the same person. She had, the bully had no idea that was the case, and like the different ways that she kind of got back at that bully, where she's like, "Yeah, let's go on a date. We'll go play my favorite video game," and then just starts watching his ass get rocked in the video game, and just like, it's wholesome stuff. Gigi, why are you screaming? What are you doing, young child? My cat is not very happy.
Oh no.
Hold on. Let me just... Gigi, come here. Come here. Yeah, I know. You have opinions.
Mo Scoville says, "I just think the director of this constantly saying, I don't think we have enough shots of you staring off in the distance and looking sad." That's so true. That's exactly how they directed this.
Hey, Gigi, you feeling better now? Do you feel a little more together?
Kitty.
Hello, this is my 12-year-old cat, who is very loving, but also very
Aw.
obsessed with being wherever the dogs happen to be. Though right now she's upset that there are other animals outside. That's where she is.
My cat's favorite place to stand is like right in front of my computer screen where I can't see anything.
Because it gets her attention, even if it's negative attention.
Right?
Gigi,
Oh no, I called Raymond over. He's thinking about jumping in front of my computer screen again.
God, you too? Hi, kid. Hi. Oh God. No. This is not time for every animal in my house. Yes, Growlithe, I understand. You're a happy girl. You got a bath yesterday. I need you to hop down. Thank you.
Just waves and waves.
Just they saw Gigi on me and just went, I mean, that's a small dog. What if other equally small dogs, because we are definitely small dogs, could jump on you as well?
They're taking turns.
They are. They are.
I would consider it to have been a mental breakdown. I don't use that phrase lightly. It was 6 weeks and 2 days after I had gotten surgery when I started detransitioning.
Okay. That happens.
As soon as my natural hormones kind of kicked back in, I really wanted to have biological children. The manifestation of that.
Wait.
Relatable.
My hormones kicked in. Now I want to pop out babies.
Hey, it's just like all the trans women that get on estrogen and like, wow, I need to be bred.
Yeah, they're just like impregnate me. We will try. We will try.
If it doesn't work, you just
Desire
gotta keep
was
trying.
very much stifled by the testosterone use, which made me really, really wish that I had gone off of testosterone.
Wait, so you were less fertile after the testosterone. So you experienced the exact same thing that any man who has ever worn tighty whities for an extended period of time has experienced. Because those also negatively affect fertility. Like, if we're going to talk about all the things that can negatively affect fertility, there are several, and tighty whities is on the fucking list. Hi, Growlithe.
Crazy.
What are you up? What are you up?
For a little while before I went under the knife, I didn't think about breastfeeding before getting surgery. Nothing like this was discussed at my consultation. I went back to Planned Parenthood after stopping testosterone. I met with the same nurse practitioner who had prescribed me testosterone. I wanted to know what was going to happen to my body, and she had no idea.
I'm going to have to pause that for just a second because my dogs are now telling me it's time for them to go outside.
Oh no. I can start responding. It really seems like when the doctor said that they don't know, it's very similar to how they're going to say, like, these are all the effects that we know testosterone does. We don't know how much you're going to get these certain effects. We know what's generally permanent versus what's generally reversible, but the degree of how much something's going to be reversed versus how long it's going to take for something to be reversed, like, for example, whether or not you're going to keep, like, the little patch of, like, tummy hair you get from being on testosterone, or any kind of, like, facial hair, it's usually going to at least go down a little bit after going off of testosterone. But they can't know for certain, once again, because they can't have, like, a perfect knowledge of these are all of the genetic factors and what's going to be turned on versus off for hormones. But if you're, like, detransitioning in the FTMTF direction, you can kind of expect it to be similar to, like, what a trans woman would acquire upon going on estrogen. So, yeah, she should absolutely see, like, all the feminizing effects of estrogen start to take effect again, and then that'll often diminish a lot of the effects of testosterone. Some things will be permanent, like there will be permanent voice changes. Some amount of hair growth is usually permanent, but it usually goes down a little bit. They just can't know for sure at that point, because you kind of have to wait it out and see what's going to happen with the hormones, just like a trans woman would.
I am back. I obviously have no context for everything that was said in the last 2 minutes.
She kept saying it's different for everyone, there's no way to know. That was kind of the moment I just realized, like, wow, like,
That's
this
exactly what I
woman
said.
doesn't even
Like that's just kind of how the body works, though, for all trans people. You don't know what it's going to be like after all the hormones. That's just normal.
Yeah, you kind of like, we know what the effects are. You just kind of have to wait and see how much you're going to get versus how much things are going to diminish, versus how much is going to be like reversed. And a lot of things that have like some amount of permanence are somewhat reversible. Like even trans women that go on HRT will notice like hair starting to thin out and like body hair, facial hair, etc., etc.
Why is everybody in my chat talking about breeding kinks now? What the fuck is wrong with every single one of you? Seek help. There is a better way.
I swear, you give them one estrogen pill.
This is like when we were in Yonkers and the conversation shifted to Pokemon for 1 second, and then a random person from the elevator comes and sits down on the couch with us, and suddenly it's all about, hey, do you think Lopunny is the most fuckable Pokemon?
No, it's Vaporeon.
Yoy.
even know what she's talking about. I don't understand how my consent could have been informed if the person prescribing it to me doesn't even know what happens if I stop.
What? No, they don't know what's going to happen when you stop, because the way we don't have a little lens that lets us know exactly how the body is going to operate with hormones. We don't have that. We know generalities. We know what most bodies experience, but we don't know the specifics. I don't know how my consent could have possibly been informed. Bitch, it is 2024. You had the internet.
I mean, and there's in her handout sheet that she received, there's like this chart that has all the effects of testosterone, expected onset, expected peak times, as well as whether or not they're reversible or permanent. Like, just cross-reference that list, and you should have an idea of like what we can know is going to happen going off of testosterone.
No, the nurse didn't specifically tell me in their specific words. Therefore, no, that's not how this works.
Unless the nurse knows exactly what my genetically encoded breast size is, how could my consent have been informed to grow these boobs?
Let alone, like, me knowing. My voice is not the same as it was. I hear myself laugh in old videos sometimes, and it just feels painful. I am very glad that I was not on testosterone long enough to start growing dark facial hair. But I have peach fuzz that grows in that I have to shave every like week or two.
Did you know who else has peach fuzz they have to shave every week or two? Literally most Hispanic women. Like, cis women experience this too, hon.
Yeah, also, like, even as a cis woman, like, you could get laser hair removal if you really wanted to. Like, if you're having problems with peach fuzz or other facial hair that you got because you weren't on testosterone for a while. I mean, even like cis women with PCOS, it's very common for them to get laser hair removal because, yeah, a lot of women don't like having facial hair. And so there are methods, procedures you can go under to remove that. Like, there does exist healthcare for like detransitioning people. A lot of it's going to be more in line with opposite trans people. Like, detransitioning women, like FTMTFs, often kind of want a lot of similar procedures to trans women.
I have sideburns that I cover up with my hair. I have body hair now in places I didn't before, like my stomach and the back of my hands. I'm still dealing with a lot of tightness in my chest, and I have to do oil massages multiple times a week. I have nerve pain that happens in my nipple grafts. It just happens randomly. My sex life is also impacted by just the fact that I don't have breasts. I feel like I'm missing out on a very fundamental part of a female sexual experience.
Wait, so you're just having the flat-chested experience?
I have to ask, like, how important were her breasts to her sexually before she decided to get top surgery?
Yeah.
Right? Like the way that she frames this, like, That's what's confusing me. I also know another small detail. She mentioned like the oil that she puts on her breasts. I believe she's referring to scar oil. Basically, like with a lot of surgical scars, there's like oil you can put onto it to reduce the appearance of scars over time.
Mm-hmm.
So it's not like something where it's like, oh, I have to put on oil or my chest isn't gonna work anymore. Just like this is what you do to reduce the appearance of scars.
Yeah,
And
like,
that's just common procedure with any kind of scarring.
that's just what happens. Anybody who's ever had a scar has Googled, hey, how do I get rid of this thing? Like,
And it is something that is at the forefront of my mind basically every time I do anything of that nature. Additionally, there's the aspect of the clitoral growth that also affects my sex life negatively. I'm not going to go into too much detail about it, but it feels worse than it used to. I was diagnosed with Asperger's syndrome at 17, which
at 17, that's kind of interesting because from what I understand, we've mostly abandoned that particular diagnosis for the most part. Like, it's just ASD now.
Yeah, mostly it would be under like autism spectrum disorder, and actually like the correlations between autism spectrum and like gender dysphoria. For like a binary trans identity, you're like 5 times as likely to adopt a binary trans identity if you have autism, and then you're like 7 to 8 times as likely to adopt either like a non-binary, gender fluid, gender queer identity if you have autism.
Almost
So,
like
the
gender's
correlation like really goes in that direction, like pretty heavily.
it's almost like the fact that gender is a very it's a very socially constructed thing for us, and autism tends to be this this lovely thing where socializing, anything that isn't part of the social aspect of your existence, is affected if you are on the spectrum. So of course the gender part of that's
like,
going to be affected.
Especially for autistic people tend to prefer like being genuine, being true to yourself over like conforming to society's ideals, and that's very helpful for actually coming out and identifying as trans.
which is classified under the DSM as autism spectrum disorder. I didn't understand why I was having so much more trouble with basic things than everyone else, and it made me feel really alone, and I needed something that would fix me. And trans identity really offered that. It offered a step-by-step guide to a better life, to feeling better about yourself.
A step-by-step guide to feeling better about yourself if you happen to be trans. It's a step-by-step guide to feeling better if you are having dysphoria. Transitioning does not stop the tism. It's not
and it's also very, very thoroughly discussed in the trans community that like treating gender dysphoria, transitioning, whatever that means to you, isn't going to solve all your problems, but it can help a lot with that one problem.
Yeah.
I am 20 at this point. I'm working, trying to save money. I do want to go to college eventually. Once I'm in kind of a stable enough place mentally, I think it'll be good for me.
Yes, we end on the filing of the lawsuit. This is quite literally a preamble to a narrative that'll be talked about in the news media for a little while, and then if it wins, they run off to the races with it, and if it doesn't, they've already convinced the people with the media that they needed to.
Well, then also it's like, oh, look at these corrupt court systems that won't even hear out this poor girl. Don't look into the court case. Don't look at all the contradictions that are plainly clear in the court case. Like I found in one section it claimed that she wasn't counseled on this one thing when like literally 2 statements earlier it literally described being counseled for that exact thing. The court case document itself is a mess if you want to take a look at it yourself.
Jeez. Independent Women's Forum reached out to Dr. Rockmore and Planned Parenthood for comment. They did not respond. So this is the part where I want to very quickly show something here. Because if memory serves, right, the Independent Women's Forum is actually a conservative think tank, correct?
They're like a major turf organization, I think. Yeah.
Well, let's see here. A quick Wikipedia check here. Founded in 1992 as an ad hoc group, Woman for Judge Thomas. Created to reinforce Clarence Thomas against allegations of sexual harassment and other sex-based illegal behavior. That is a sentence.
Amazing.
What?
Amazing. We were founded to help clear this guy of like sex crimes.
What the fuck am I looking here?
Independent Women's Forum, everybody.
In 2009, the IWF produced a political advertisement run on YouTube and in 8 states arguing that 300,000 American women with breast cancer might have died if U.S. healthcare included a government-funded option. FactCheck.org labeled them as a false appeal to women's fears, finding that the IDWF ad relied on old statistics, faulty logic, and false insinuations. Let's see here. They've got a whole thing on Title IX. They've got... Oh my god. Here's one that's not going to seem strange to anybody. Is a member of the advisory board of Project 2025.
There you have it. There you have it.
A collection of conservative and right-wing policy proposals from the Heritage Foundation to reshape the United States federal government and consolidate executive power should the Republican nominee win the 2024 presidential election. Actually, Chad, if you remember, we just covered the section where they wanted to consolidate all of our immigration stuff into the DOJ and then replace all of the federal employees who had been there as career employees with Trump appointees. So
they really like assembled like the entire like metaverse of supervillains for Project 2025. Like it's crazy.
Yep. Full circle moment. Who could have fucking guessed from stuff? Yeah, it's amazing how much of this just loops back to Project 2025 every fucking time. It's insane. The tinfoil hat isn't on tight enough, I guess.
I am joining the League of Letters against Project 2025.
The League of Letters? Is it the letters in LGBTQ or
yeah.
like? In court documents, the defendants denied the allegations. Okay. Isn't that the first thing that would literally always happen in a court case?
Well, yeah, because basically the court documents are like, this is malpractice. They didn't obtain informed consent, and the defendants are like, yes, we did. Here's her signature on all of our informed consent documents, and here's all of our clinical notes.
I don't want this to happen to other young people like me. Young people with mental health problems who struggle to find their identity. I don't want them to be rushed down this path and to feel like this is the only...
I don't want them rushed down this path. You literally pointed out you were the one doing all the rushing.
Yeah, like her language, it's so crazy how she jumps back and forth between like, I made all these decisions, I chose to do this, like all this active voice, and then also I was led down this path, I was swept up by this cult. Like, you can't have it both ways. Like, either people forced you to do this, or you chose all of these options.
Like, the only way to have been Russian more than her is to invade Ukraine now.
There's literally no way to force someone to transition. Not really. I mean, like, what are they gonna do? Like, Planned Parenthood nurses are gonna like break into your house at night and inject you with testosterone against your will? That's not happening.
I'm sitting here with the vial of estradiol and your gummy bears.
The moment you like a trans TikTok, they actually send a Planned Parenthood nurse practitioner to your house that very night to inject you with hormones.
Jassa says there are no defendants in a civil court. It might be a nitpick, but the fact that they use a criminal court term in a civil case is just lazy. Is this a civil suit?
She's trying to file for a jury trial.
Okay.
Only choice that they have to live a good life, because it's not, and people don't tell you that in these kinds of spaces. I wish that I had gotten more pushback when I started identifying as trans. I wish
that there had been more bigotry against me. God, I wish there had been more bigotry against me.
Wanted to
I mean,
medicalize.
if you wanted more pushback, like you could have gone down the route that has more pushback, like the psychiatric route.
The one that involves you talking to a therapist who will psychoanalyze you. The one that involves you having to talk to a doctor afterwards, getting a letter of consent. Like there were two lanes you could have gone down, and you chose the fast lane, and this is where you're at. This is the side effect of that.
If her ultimate goal is that she doesn't want people to make the same mistake that she did, then I would hope that she would do advocacy for, like, hey, if you're kind of confused, kind of unsure about your gender, I would recommend going down this more slow, this more careful route. Like, yeah,
but that's not what she does here.
That'd be totally fine.
Instead, the narrative that is pushed here is, I think it would be safer if people just didn't. It would be safer if people just didn't transition.
It really sucks that there's this 1% regret rate, but the 1% regret rate does not get to take away the 99% of happy patients who are coming out lives transformatively better due to gender-affirming care. That just doesn't make any sense at all.
And I wish I had gotten help for my mental health issues before it even got that bad. That I was.
You could have just gone to a therapist. Like you could have just done that. I wish I had gotten help. Cool. You could have sought help. That's a thing you could have done.
Her court case describes that, like, they wish that the system would require that these doctors have to treat and resolve all of her underlying, like, mental health conditions before they can prescribe hormones. Which, like, how do you treat and resolve autism? Like, autism is not something you cure. Autism is just, like, something you are, something you have.
Also, if your underlying mental health condition is a comorbidity of gender dysphoria, then how are they supposed to treat that before the gender dysphoria? Like, there's
right, like, and that fails in the 99% of cases.
Like, what she effectively wants in this case, or what maybe more accurately, what the people who are puppeteering her want, if I'm willing to put on the tinfoil hat, what they are wanting is to put up more barriers to entry for trans people who, in the 99% of cases, do not experience these levels of regret, do actually need this stuff for their mental health, and if we want to be really morbid, which I'm willing to be here on the internet, some of the people who are funding this probably, maybe, allegedly, would rather that 99% turn to a closer to a 40% number, because they are happier when the people they do not like cease to exist on the planet, which is really shitty, because that's the end result of trying to put a billion barriers up for trans healthcare, is you end up with trans bodies.
I don't get why they would do that. Like, where are all these conservatives going to get their trans porn from if they go down that route? Like,
God, even
conservatives love trans porn. You can look at the statistics on that.
Even Nick fucking Fuentes.
Yep.
Just catboy porn. Where's the catboy porn going to come from? It's all gone.
Was wanting to identify as trans. There's just so many places that I could have been helped, and I want that for other young people in my...
I want a system for other young trans people that already currently exists.
Cool. Sounds good.
We agree. What you're doing though is you're aiding organizations that do not want those systems to exist. You're aiding organizations that want to eliminate the system that you went through. As an example, 6 years ago, there was a stream that I did for a homeless trans person named Arachne. Those of you who are in my chat know where the story is going because you've already followed this saga once before. I had a very small community around that point, only about 2,000 or 3,000 people, and we were only able to drum up about $300 of support that got them a few days in a hotel, and that was it. Several years later, I found out that their homeless situation had not improved. She had not been able to secure stable employment, and when she was able to, things went sideways. When you're homeless, that happens all the goddamn time. So when that happened, I said, fuck it. I've got a bigger community. Not only can we run a better fundraiser for you now to help you with this situation, which I'm not in a position to do as of right now because of a ton of debts. But at that time, I was in a position where I was able to help. So I said, cool, we're going to do two things. Your girlfriend lives in New Zealand. You've been trying to get to New Zealand for 6 years now. And unfortunately, that was not possible back then. My community's bigger, my means are better. I'm going to drive down to Florida. You are going to live in my house for an amount of time. I will get you set up with whatever networks need to be there so you can get your HRT and all of that stuff because you're 30 and you know what you want. And then we're going to go ahead and get you a ticket to get to New Zealand so that you can go live with your girlfriend and go actually start having a happy life instead of living in a homeless shelter. I have the ability to do that now. I'm going to go ahead and fix the fucking problem. It's going to be done from top to bottom. So she's in New Zealand now. She's on HRT. All that fun stuff has happened. And she started HRT while she was at my house by literally just going through Plume, which is a wonderful organization whose entire point is the informed consent model going, hey, you know you need this thing already. We're not going to baby you. If you ask for it, you will get a prescription for it so you can then go down whatever route you need to do to fill the to get that prescription filled, either at a local apothecary, pharmacy, or like Amazon will tend to deliver, especially if you're in Florida, and that's one of your ways you have to get around all their stupid shit. There's lots of ways you can do this shit in network. So that system existed and worked really well because the other option, the option that involves a lot of psychotherapy for a year or two, that option is incredibly expensive. And for somebody who was unemployed and literally going to be leaving the country, so there was no point in getting employment, that was not a good route. That was a dumb route to try to go down. The informed consent model, the one that involved, hey, let's go ahead and just do what we need to do now, get the prescription now, so that all of that is ready to go when they go to New Zealand, where there's going to be a hiccup in prescriptions anyway, because the pharmaceutical system there is completely different to ours, made infinitely more sense. Eliminating that option for trans women is nightmarishly stupid, naively dumb, and I can't think of more synonyms for absolutely idiotic right now.
Yeah, I mean, like, and you can look at this in, like, all fields of medicine. Like, it is so important to have this, like, really individualized doctor-patient relationship because not everybody's medical needs are the same. Not everybody's, like, amount of screening or amount of evaluation that they're going to need for something is the same. And, like, having these different routes that people can go down, that people can assess, like, okay, I'm kind of unsure. Maybe I want to go down this route, or I have researched everything. I know that I look at all of the effects of estrogen. I'm like, I don't like, where's the catch? I don't see the catch. Like, if that's you, then like, the informed consent route is right for you. And just like the fact in this country that we have this kind of individualized doctor-patient relationship where you can get the care you need, whatever that may be, like, that's a beautiful thing.
Yeah.
And the government getting in the way of that is just going to make medicine worse.
Yeah, why would you want to eliminate that option for other people so that you can push an option that already exists for all of those people who want to go that route? It's insane to me. The degree to which we are medically misinformed in this country is staggering.
Crazy. Absolutely crazy.
Position.
Sad music.
Is it just sad music all the way to the end?
I think it's just sad music all the way to the... Yep, and then it's the little Independent Women's Forum, idwf.org/identity crisis. That's what this is. Okay.
Slash Project 2025.
Yeah, slash Project 2025. I did not know that they were involved in Project 2025 when I walked into this stream.
I already didn't know that either. I had already seen information about this case, and I didn't know they were involved in Project 2025.
Yeah, of course, and we're here. Like, that was a discovery we made live. So, where are you at on this, Naomi? What are your thoughts?
Yeah, I mean, like, ultimately, it's just a lot of the same story we see with these detransition cases, where the framing is just completely backwards based off of the details we actually know about the story. Like, this person deliberately chose to undergo the informed consent route as an adult, and they just don't see that for the 99% of cases, which are unlike them, this kind of healthcare is super important and super life-saving for trans people. And yeah, I mean, I absolutely sympathize with anybody who experiences medical regret. That sucks, and I hope that they can get any kind of reversal or adjustment care that they need.
Yeah, like we don't
But
want to be
just
malicious.
because you made a mistake doesn't mean that you get to take away this healthcare from everybody else. If one person could regret their knee replacement surgery, and then nobody can get knee replacement surgeries again, then in 5 knee replacement surgeries, nobody would ever be able to get their knees replaced.
Like, can you imagine, as an example, right? People who have had gallbladder surgeries, for instance, where they've been removed, their body's ability to regulate acid goes just down the drain, through the toilet, because that's one of the things that your body is trying to be able to do with that. So, can you imagine if somebody who's had that surgery is stuck on the toilet, they're feeling just immense pain, and they're like, man, I wish nobody ever was able to get this removed, even if it was killing them. That would be nightmarishly stupid. But that's what this is. That's exactly what this is. This is somebody who's having a regret from a surgery, which happens. There is a statistic amount of this that happens all the time. Naomi knew more of the statistics than I did off the top of her head, thank God. Relying on those outliers is a dumb thing to do. The only people who do that are extremists who will use whatever opportunity possible to supplement their narrative, or children who are too naive to know any better. Those are the two types of people who tend to favor this. I found one example of this, therefore it all has to burn in a scorched earth
Yeah,
fashion.
and just like a good thought experiment for people that are like ever like encounter this kind of propaganda for literally anything. Just like try to replace trans healthcare with any other kind of healthcare. Try to replace try to replace things around, see if these principles still hold, and it's just like so easy to see how they fall apart. Like one person had regret from chemotherapy because there was complication with chemotherapy. Therefore, we shouldn't treat any cancer with chemotherapy. That's crazy. That's literally crazy.
Yeah.
I regret eating last night's burrito. Therefore, we should never make
Nobody
burritos
should
again.
get a burrito.
So true, Mo Scoville.
I did I had to take Tums today because it's my cheat day for my diet, so I had Taco Tuesday followed up by a cookie from Crumble, which was a terrible thing.
Sorry,
for me to
guys.
do.
No more cookies. No more Taco Tuesday.
No cookies, no tacos, no nothing. It was
Suris had regret, so we're just gonna have to.
we can't do that.
When's your lawsuit coming out?
I think it's probably going to come out sometime never. Because I can help it with a combination of Tums and printing things off my printer and looking at them and saying they're pretty. They're
Wild.
like a sane person.
Well, at least you seem well adjusted about it.
Yeah, for now. Eventually, I'm going to go ahead and go on an entire tangent about how society made Taco Tuesday, so society must burn, or something like that. Who knows?
And, I also want to mention that, I've seen plenty of detransitioners that do detransition and are incredibly well adjusted about it. And it seems like the biggest factor for those people is just understanding, the context that led them to transition and the context that puts them in as a person today, and just integrating that into a holistic experience as a person. It's ultimately all of the experience of your life that makes you who you are. You wouldn't be who you are if you didn't momentarily transition, detransition, and, you kind of live your life in a way that's almost opposite trans-like, and that's kind of beautiful in its own way.
Yeah, and even though that sucks, it sucks that you went through that. It sucks that you had that negative experience with this. That is no reason to quite literally ruin it for everyone else. Group punishment was a dumb thing when we were in elementary school, and it's
also a war crime.
It is that too. Technically speaking, it is that too. But it was a dumb thing when we were in elementary school. Maybe we should have taken the lesson from that it was a dumb thing to do as adults instead of figuring out ways to do it more. I don't know. Stop says, screw this anti-trans propaganda. I have tentacles. I can do what I want. I mean, you are an artist. You not only have the ability to give yourself tentacles, you have the ability to draw your detractors pregnant. That is within your power to do.
Whoa.
I'm not saying you should do it. I am saying it's ethical. But that said, I think that's all we've got where this particular bit is concerned. So for people who are on my stream, who may not be familiar with you, Naomi, do you want to go ahead and give any final closing thoughts for them? Anywhere where they can find you? Anything like that?
Yeah, it was my pleasure to join stream with Suris. Was really glad to meet him in person. Yonking it for Jamal Bowman in New York. just a couple months ago, and yeah, really glad this collab could happen. If you want to check out any of my content, you can find me nominal.naomi, TikTok, YouTube, Twitch. If you like talking queer politics, debates, check it out. It's a fun time, and we'd love to have you over here in my community. So yeah, thanks so much for having me on. If you want to shout yourself out as well, Suris, go for it.
Sure, why not? My name is Suris. I talk a lot about politics, and here lately a lot about trans issues because that's just the forefront in the political sphere as of right now. For those of you who are over on my stream, we're going to be looking at some of the fallout from the Elon Musk and Trump conversation that happened on Twitter recently.
Oh, fun time.
And I'll say that it was also a fun time being able to hang out with you in Yonkers as well, especially the I don't know if I told the story about the like miscommunication we had in the elevator. That was funny.
Oh my goodness, no,
Okay.
It's embarrassing.
Okay, so everybody, y'all know how I use the VTuber avatar a lot. Like my face is very public, it's very known, but I do use the avatar for a lot of things. So Naomi is in the reception area for the hotel. I'm down there waiting for everybody because I didn't realize that me and Saki got there like 3 hours early. And it's hot. It's sweltering. There was not AC down there at all. So any excuse to leave was what I was going to take. I see Naomi show up. I recognize her because, of course, she was on stream before. And I'm like, hey, how's it going? And Naomi is like, hey, yeah, no, it's going pretty well. We talk back and forth a little bit. And an hour previous, I had DM'd her on Discord saying, hey, what's your ETA? When are you getting here? Now, what I didn't know when we were in the elevator, as you were going to your floor, I was going back to mine to go get my cards so we could go back up to the 6th floor. What I didn't realize is that you didn't put 2 and 2 together of who I was and the person who had been texting you after we had done work together previously.
I'd only seen like your VTuber through your content, so that's
right.
Like, my like name to face recognition was with the VTuber.
Was to the avatar.
And it was like, this voice sounds familiar, but I don't know who this is.
So I get my stuff, and then I get a message from Naomi saying, hey, I just made it to the hotel. I'm dropping my stuff off in my room. And I'm like, yeah, you just told me that like 5 seconds ago in the elevator. I know that's what you're doing, that this is not new information. It was...
I was like, oh shit, that was you, okay.
It was wonderful. It was very endearing.
So that's when I got the full name to face recognition.
Yep.
Beautiful.
That's Red Jugger says, please forgive Suris, he is a dork. Look, I was watching effectively an anti-trans documentary while making Magic the Gathering 3D printed models. So yeah, probably.
If that's not a night, what is, you know?
Yeah. But anyway, thank you for not only coming on to my stream, but letting me be here for over on your stream. I greatly appreciate it. Thank you for yielding your time, and thank you for giving a lot of insight to this that I otherwise just didn't have.
Yeah, absolutely. This was fun. We should definitely do it more often.
Yeah, absolutely. We'll have to figure out some stuff for us to collab on.
All right, coolio. Well, you have a lovely night. I'm probably going to sign up here. It's getting kind of late for me over where I'm at, so...
Fair enough.
Yeah, you have a lovely rest of your stream.
You as well, and I will go
Bye,
ahead
chat.
and continue on my end. See ya. Hey, just wanted to give a quick thank you to all of my wonderful patrons who help keep me afloat and help keep this channel going. YouTube and Twitch are wonderful platforms, but at the end of the day, stability is not one of their strong suits. If you want to support my channel, then obviously Patreon is one of the best ways of doing that. Link is in the description. But I do want to personally thank everybody who has contributed to the channel. Those people would be Red Joker, Purple Poundini, Jemshin, Britzkrieg, Jupe the Malignant, Michael, Ravalern, Mabbity Babbity, Astral Frontier, Autumn and Angel, Nixie Chan, Mark Anthony, Victorian Alchemist, I'm not saying the last part of that, and you know that, Arcton Arclacier, Kiratorian, Dren Hadamata, Jordan M, John L, Lord Bleck, Smiling Game Master, and Fireshard. And everyone else who supports my channel and lets me do what I do full time. This is a dream job of mine that I never believed that I would be able to take full time, and with your help, I've been able to do it. So thank you so very much for that. Thank you for watching the video. I hope you all enjoy, and I hope you all are having a wonderful time. I will see you all in the next one, hopefully.